The research question and research hypothesis will be the topic of this video. The research question. The research question is the driving force for the research. It reflects the title, which gives us the scope, and the research hypothesis. It facilitates formulation of a research hypothesis that direct us towards the type of literature we should collect, and also it guides us for designing the objectives and the methodology for the research. From the primary research question, we can drive a secondary research or several secondary research questions. All these questions should be captivative, should attract the readers. The characteristics of the research question is that it should reflect the population of the study and the concept of the study, and the time and methodology of the study. And as we said in the title before, that the title and hence the research question can follow the eponym Finer or Pico or Picot. Finer is an abbreviation in which F denotes that it is feasible to do this study, and I denotes that it is interesting study, and of course, as I said before, if it is not interesting, it would not be published. And N denotes novel study, and as I said before, all the studies carried out during Sudan War can be very much interesting, and it can add to the literature because the scientific world would like to know about the outcomes of medical practice during Sudan War. So it will be novel. And it should, of course, follow all ethical issues, and it should be relevant to the practice. However, in the interventional studies, a PICO eponym may represent a good title in which P stands for patients, I stand for intervention, and C stands for the control group and all the outcomes. And if we add T, denoting time limit for the study or duration of the study, the time in which we have done the study, then the interventional research title will be an excellent title, and it will and the research question also will be an excellent research question. And now let us take examples. For example of a title: Maintaining Patients' Confidentiality in Emergency Room During Sudan War, an audit-based approach. If we look at this title, it shows us the patients, and it shows us the subject, that is patient confidentiality in emergency room, and it shows us the place, the emergency room, and it shows us the concept, which is the Sudan War, and the methodology, which is an audit-based approach. So it is a concise title, it is a good title. And from this title, we can drive a primary research question stating that what are the key weaknesses in protection of patients and their health data in emergency room setting during Sudan War. So the word confidentiality has been broken here into protection of patients, that the physical appearance of the patients and their speech and their health data. that is the details of investigations also. So this is the primary question, and we can drive furthermore secondary questions. And in these secondary questions, for example, what are the weaknesses in patients' physical protection during Sudan war in the emergency room? Here, we can break it down in what are the factors that intervene with the physical protection of patients. Are we talking to the patients and their answers are heard by other visitors, other persons who should not hear these questions and answers? And when we examine them, are we exposing them and their body parts are seen by other persons, some visitors? And we can drive a secondary research question stating that what are the weaknesses in patients' data confidentiality in the emergency room during Sudan war as identified through an audit-based study? You see, we are describing the whole descriptions of the title here. And we can break down the patient data confidentiality into the notes of history taken by the doctor. Are they protected not to be read by other persons, not to get lost? And the notes on physical examination, are they also protected? And their request for investigations or the result of investigations, are they protected not to be seen by others? So we can develop some variables for our study here. Now, let us take another example. Causes and consequences of OR, Operation Room, delays during Sudan war, a cross-section of the study. If we look at this title showed us the subject, which is the delay in OR, delay of admission of patients into the operation room. And the concept is Sudan war, and the methodology is cross-sectional study. And the subject here is the causes of delay and the consequences of delay. From this title, which is short and concise and attractive and captive, and we can develop a primary research question and secondary questions as well. The primary research question might state that what is the relationship between resource availability? By research availability, we break it down into personnel, the number of OR personnel, whether in the anesthesia and in the surgical part, and equipments for both divisions, surgery and anesthesia, and supplies also for both. And what are, as I said, the relationship between the resource availability of these things and the OR delays amid Sudan war. This is a primary question, and let us now look at some secondary questions. How does shortage of anesthesia, instruments, blood products correlate with OR delays during Sudan war? Now we have introduced some independent variables, and we can design another secondary questions for further variables, like how does shortage in personnel, the personnel of the surgical department of the operation room or the personnel of the anesthesia department in the operation room, or the dressing of this number of the staff in the operation room and the personnel sterilization, the methods and material for their personal sterilization. Does this contribute, any delays in these contribute to delay of patients or any deficiencies in the personnel or in the equipments or in the sterilization methods or materials or in the dressing of the staff? Does it contribute to OR delays, to operation room delays of patients? And does that delay increases the patient risk? We are introducing further variables. Now let us talk about the hypothesis. Why should we design a hypothesis? As a researcher, we should learn to design hypotheses. It is crucial. It is crucial because it provides focus. As I said, the title provides focus, and it is the driving force for the research. And the research question also develop focus, provide focus. And the hypothesis, now we should hypothesize. We should think how the outcomes will appear, will be. Also, we should focus in that area. And the hypothesis should help us to build independent and dependent variables, and we will discuss this in the coming slides. To build variables, independent and dependent variables for the study. And the hypothesis should guide us to choose the appropriate methodology and hence the appropriate statistical method. And the hypothesis suggests possible association. It is our thinking of the association between these variables. The hypothesis, it is our postulation of the relationship or correlationship or association between these variables, between the predisposing factors or the factors of the cause and their effect. We are going to demonstrate that in a minute. The hypothesis also should postulate the direction of this association. And we are going to show examples how we design a hypothesis that shows the direction of the impact of the variables we are studying. As I said before, it should also guide our the way we choose the appropriate method and the appropriate statistical analysis. Now, let us take an example. The research title. If the research title says determinants, let us suppose a research title saying determinants of wound healing among conflict-affected civilians amid Sudan war, a prospective cohort study. As I said, introduction of the factors of the impact of Sudan war will give us novelty. And it is a short and concise title. And the subjects here are the determinants of wound healing. And the patients are patients in conflict-affected civilians, and the concept is amid Sudan war. And the methodology mentioned here is a prospective cohort study. So this is a good title. The primary question that could be driven from this research title could be: what are the impacts of malnutrition, chronic illnesses, and inappropriate wound dressing as major determinants of wound healing amid Sudan war? What are the impacts of these three factors: malnutrition, chronic illnesses, and inappropriate wound dressings. You see, we have now introduced some variables, and we are going to break out these variables into further independent variables in the coming slides. The research question I have just said stated that what are the impact of malnutrition, chronic illness, inappropriate wound dressing as major determinants of wound healing amid Sudan war. Our hypothesis could be amid Sudan war, malnutrition, chronic illnesses, inappropriate wound dressing are independently and collectively associated with delayed wound healing. So we have the three: independently and collectively delay wound healing. And we can go and further develop secondary questions and further hypotheses for the secondary questions. Now, secondary question might state that what are the impacts of malnutrition? And by malnutrition, we introduce new variables: low albumin, low total protein, low body mass index, and short mid-arm circumference. 4 variables are now introduced only for malnutrition. What are the impacts of these 4 independent variables on wound healing amid Sudan war? And the hypothesis for this secondary question could be amid Sudan war, low albumin, low total protein, low body mass index, a short mid-arm circumference are independently and collectively associated with delayed wound healing. So this is a direction. Now we are giving a postulation. We are giving a hypothesis that shows directions of these variables. They delay wound healing. They increase the complication rate. It is directional. So to this point, I will stop, and we'll see you in another video.